For more, I'm joined by Kuda Kapfumvuti, who is Senior Manager for Health Products Authorisation at Sahpra. Thank you so much for your time. So, according to international reports, 66 children have lost their lives across the globe. Firstly, do you have those official numbers, and can you give us the names of the products that people should be avoiding?
Thank you very much, and thank you for having me. So, yes, indeed, according to the released alert, starting with the World Health Organization, we have 66 children that have died. And basically, this is due to consumption of 4 cough syrups that have been identified. And these cough syrups, if I can name them, we have promethazine syrup. We also have another one that is called Macof baby syrup. Then we have Magrip N cold syrup. And the last one was identified as Cofexpalin baby syrup. So all these 4 products are cough syrups for children. And they've actually resulted in those deaths.
Can you tell us what is wrong with them? The WHO said that these are substandard medical products, but surely all medicines worldwide are stringently tested and regulated so as to prevent exactly this kind of disaster. What went wrong?
That's correct. So in these medicines, there were traces of 2 chemicals that we found in them that are called diethyl glycol. The other one is called ethyl glycol. So these toxic substances, when they are ingested or when they are found in medicines, they actually have been known to have toxic side effects. So there could be reasons for contamination, and investigations will be able to determine what really caused this contamination. But these 2 substances shouldn't have been in those cough syrups. And then they have actually resulted in the toxic side effects. If I can just go on, the toxic side effects associated with these chemicals include diarrhea, also includes vomiting, it includes acute kidney injury that may lead to deaths. So that's why you see that we have these children that have died. And I can say it's after the discovery of these deaths of these children that these cough syrups were tested. There were laboratory tests that were done, and then these traces of ethyl glycol and diethyl glycol were found to be in those cough syrups. But investigations are still ongoing in terms of determining why and how those toxic chemicals found themselves their ways into those products. But that's what I can post for now.
Yeah. So these, as I said in the introduction, they're not registered for sale in South Africa. A couple of short questions all in one, if you don't mind. Is there any possibility that these cough syrups could be found in South Africa on the shelves of shops? And what is your advice to South Africans who may be traveling abroad and who might be forced while there to buy cough syrup for a child and might be fearful of buying the wrong thing?
Thank you very much. So I can confirm these products are not registered for use in South Africa. These 4 cough syrups that I've mentioned, they are not registered for use in South Africa. So definitely you shouldn't find them in the shelves, in pharmacies, in any retailer. So the thing is, we always encourage, as Sahpra is the regulator, we always encourage the public to purchase medicines from registered facilities, from registered personnel, because that will ensure that you are buying the quality, safe, and efficacious medicines as governed by the Medicines and Regulatory Medicines and Related Substances Act 101 of 1965, which governs us in terms of our mandate. So that I can confirm, you will not find them. We actually have a well-regulated supply chain in South Africa, where pharmaceuticals are sold via a controlled and a legitimate supply chain. So that starts from the importer to the wholesaler to the pharmacies. So in that regard, we as Sahpra, we have a mechanism that detects such activities of having those products finding themselves in the shelves. If things are done properly, you shouldn't find themselves the products in the shelves. So you find that we have designated ports of entry where medicines are supposed to enter the Republic of South Africa. That encompasses Durban, Cape Town, Port Elizabeth, covering both airports and the harbour. And then we also have OR Tambo. So at these ports of entry, we have got customs officials. We also have port health port health officials that are at these ports of interest, and they help in ensuring that they can detect any medicines that are supposed to enter the country. However, as Sahpra, we also have a regulatory compliance unit. So should anyone know of anyone that has got these 4 cough syrups, we encourage them to stop using them and to not give them to their children. We also encourage them to report to Sahpra, the regulatory compliance unit. If you go on the Sahpra website, we have got a contact us facility that they can actually enter through, and they can just search for regulatory compliance. So under regulatory compliance, there are colleagues there that actually have their contact details, their full names and surnames, email addresses, mobile numbers, and landlines. Then you can report to those colleagues
Mr. Kapfumvuti, I do apologize for interrupting you. Unfortunately, we have run out of time there, but hopefully since the alarm has now been raised, those products will be investigated wherever they are sold in the world. Thankfully, not in South Africa. However, South Africans should still be mindful of those products. Thank you very much. That was Kuda Kapfumvuti, who is Senior Manager for Health Products Authorisation at Sahpra.